Penile implant surgery. Your questions and answers. Brought to you by FixedED, www.fixeded.net.au.
I'm Bill Lynch. I'm a urologist from Sydney. What I would like you to all think about is that there are many true and proper treatments for erectile dysfunction. Despite the rather bad press at the moment, there are reliable and safe therapies that are readily available and well within everyone's means. If you are suffering from erectile dysfunction, I encourage you to speak to your GP about the condition and ask to be referred to a urologist who has an interest in this area. Erectile dysfunction essentially means that a man cannot have satisfying intercourse. It mostly occurs because his penis does not get hard enough or does not stay hard for long enough to have satisfying intercourse. Occasionally, he can also suffer from premature ejaculation, which means that he has his orgasm in too rapid a time to allow either he or his partner to enjoy the experience. Erections occur when a man gets stimulated either visually, sensually, or in whatever normal way turns him on, if you like, and blood enters the penis and fills what's called the spongy tissue inside the corpora or the cylinders inside the penis. When these cylinders engorge with blood, the man's penis becomes erect and rigid. It stays that way until the finish of the stimulation or intercourse, and then the blood vessels open up again, the blood leaves the penis, and the penis goes soft, or detumesces is the medical term. There are a number of treatments for erectile dysfunction. Usually we start with one of the oral medications such as Viagra, which allow the blood vessels to expand and help a man achieve the erection. But these are not satisfactory. There are what called intrapenile injections, which inject a vasoactive drug, which once again stimulates the penis to have an erection and allow intercourse. There are vacuum devices, which some people find satisfactory, though in effect often give what is called a cold erection. And finally, we have our more long-term solution, the penile prosthesis. This does involve surgery, but the prosthesis is inserted inside the penis and inside the normal tissue. There are many causes for erectile dysfunction. The most common overall is the effect on our blood vessels. Everyone gets hardening of the arteries to a greater or lesser degree, and the blood vessels of the penis need to change calibre quite dramatically. So even minor amounts of blood vessel damage can cause erectile dysfunction. Causes such as diabetes, heart disease, a lot of medications such as blood pressure medication, sedatives can also contribute to the lack of erectile function. These days, with many men requiring treatment for prostate cancer and undergoing surgery and radiotherapy, damage can be done to the nerves and they can suffer erectile dysfunction because of that. Many bowel operations and pelvic surgeries, apart from prostate surgery, can also result in erectile dysfunction. Our lifestyle can of course influence our chances of getting erectile dysfunction. If you smoke, you are overweight, you do not exercise regularly, these can also contribute to the development of erectile dysfunction. We certainly know men who are in their normal sort of body weight index and who exercise regularly have at least a 40% lower chance of developing erectile dysfunction in their lifetime. Penile implants are probably our most permanent solution and often regarded as the gold standard of treatment for erectile dysfunction. Essentially, a penile implant consists of three components. There are cylinders that go inside the penis, and they're the cylinders that will fill and make the penis hard. There is a reservoir, which is filled with saline, and a pump, which is situated in the scrotum. When the pump is manipulated, fluid from the reservoir goes into the cylinders inside the penis, which gives the erection. When intercourse is completed, there is a button on the pump which allows the fluid to leave the cylinders and go back to the reservoir, which allows the penis to become soft once more. The big advantage of the penile prosthesis is because it lies completely within the normal tissues, it simulates a normal erection very well. Most partners are not even aware that there is an artificial penile prosthesis in place when it's being used. It brings back spontaneity because it is always with you, and it only takes manipulation of the pump, which can be part of normal foreplay and not even recognised as such, to allow the erection to occur. To have a penile implant, it does entail surgery. It is usually just an overnight stay with a single cut. You need to stay reasonably quiet afterwards, but once you have recovered, you will return to normal sexual activity quite rapidly. When a man has a penile implant, when he wants to have intercourse, he manipulates the pump in his scrotum. Pumping that pump, so to call, will give him an erection which lasts as long as he requires. It will stay there until he actively decreases or depresses the button to allow the penis to go down. Peyronie's disease is a condition that affects the penis. Scar tissue forms along the corpora, the tubes that hold the erection, and this means that the penis takes on a bend during the erect state. This can sometimes be painful for the man or his partner, and in fact the bend can be severe enough to prohibit normal intercourse. There are many treatments for Peyronie's disease, and certainly you should seek help if you find you suffer from this disease. There are many true and proper treatments for erectile dysfunction. Despite the rather bad press at the moment, there are reliable and safe therapies that are readily available and well within everyone's means. If you are suffering from erectile dysfunction, I encourage you to speak to your GP about the condition and ask to be referred to a urologist who has an interest in this area.
Penile implant surgery. Your questions and answers. Brought to you by FixedED, www.fixeded.net.au.